This is an ultrasound study of a primary gravida. A cousin marriage. We see breech presentation, baseline, and this is the scalp bone, and this area is the edema around it. And the edema can be seen stretching over to the other parts of the fetus. Skin is edematous. This is all edema. Now this is the transverse of the abdomen, where we are able to see ascites. This is all ascitic fluid in the abdominal cavity, and here you see there are two kidneys seen. The kidneys are seen. This is kidney number 1, kidney number 2 in transverse section, with vertebra in the center. And this is the second kidney. This is the vertebra. Fetal ascites. Placenta posterior wall, and above the os. This is the placenta, and you can see it tapers off over here, whereas this cervix is far away. Here we are. This is the cervix, and here is the placenta. So posterior wall, placenta above os, and with ascites, fetal ascites, as well as pleural effusion. As you can see that this is the fetal lung. This is the lung tissue, and here you see cardiac flicker, and in between you see this is the fluid. You see this is fluid. This is a better view. The cardiac activity is seen, and here you can see a better view of the pleural space with the lung, and this is the lung tissue, this is the fluid in the pleural space, this is the heart, and the cardiac activity is between 136 to 140 beats per minute with regular waveform. This is the cephalic portion of the vertebral column, and this is the caudal part of the vertebral column. No outgrowth seen from this region. And this is the head of the fetus, nuchal fold. This is the nuchal fold. Neck region should not exceed more than 4.6 with a normal. No pathology is seen in relating to the brain. The skull, though edema is seen, and you see that neck is okay, no outpoaching, no membranous structure seen in this region, and however you can see edema around the skull. This is the skull, and it is surrounded by, now these are the skull bones, and this is the edema around the skull, that of the fetus. Case of now you see again in this view, this is all edema. This is edema of the skull. These are the eyes, and you can see that the distance between the two eyes is in correlation with the term that we use as hypotelorism. Now this is number one eye, this is second one, and this is the interocular distance is 2.8 centimeters, and whereas the intraocular distance is 9.6 millimeters. To show you abdominal structures. Now this is the liver. This structure that is in view is the fetal liver. This is the liver. This is the liver, and these are the matted bowel segments. You see, these are matted bowels. Rest, you can see the movements are seen. Fetal movements are visualized. This is the portal vein. So this is a case of RH incompatibility with fetal ascites at gestational age of 23 weeks, as bilateral diameter is 5.5. Here you can see that this is the lung tissue floating in the ascitic tube. So this is our case of the dating breech. Now this is something which is important in such cases. You see that the bilateral diameter is corresponding to 5.1, and the centimeter that corresponds to the gestational age of 21 weeks. Then femur length is 3.33 centimeters that corresponds to the gestational age of 20 weeks. And then occipital frontal diameter should be taken in such cases, measures 61.6 millimeters, head circumference 190 millimeter, and that corresponds to the gestational age of 21. Now, considering all these measurements, the fetal age is about 20 weeks, 3 days, plus minus 3 days. Gestational age is 20 weeks, and this is important because in breech presentation, the head circumference, the bilateral diameter is at times not accurate, and however, occipital-frontal diameter is usually persistent or consistent with the gestational age. Abdominal circumference, though, and the weight cannot be determined because of fetal ascites and protuberant abdomen. So this is essential in this scan. Thank you.